Okay, so for the second part of the musculoskeletal and neurological exam, we're gonna kind of concentrate on the lower extremities, range of motion. We're gonna be kind of just observing some things as well. So first thing I'm gonna do is go ahead and observe for symmetry. So I'm just gonna worry about everything from the hip down at this point. Looking at the legs, and I'll have the patient laying down too, and then I could look for symmetry as well. So it's almost just like a normal head to toe physical where you're looking for symmetry. You're also kind of palpating the skin, checking for warmth, moisture, anything like that. All the way down to the toes, basically. So don't see any deformities, don't see any trauma. He hasn't said there's any pain, so there's nothing that we need to concentrate on specifically, okay? So we look at skin characteristics as well. You would look at the hair distribution on the body and the legs as well, because we know blood has to flow out from the heart and back up. And a lot of times when there's issues with hair distribution, it's because there's a circulation issue. So we would be looking for that. If hair is not growing on the end of the on the tops of the feet, basically in the toes, then we know that there could be a issue with circulation there, which is also why we would check for varicose veins. He doesn't have varicose veins, but when those do appear, that could be an issue with valves. The one-way valves not working appropriately could be weakened, and then that blood is actually pulling back into the body. So I'd be looking for that, and I don't see anything there. So while we're talking about circulation, I would go ahead and palpate. So again, you would do everything bilaterally. I'm not going to do that here for the sake of time. The first thing we're going to do is the dorsalis pedis. You can actually see his on here. Hopefully you can see that on the camera. But just go up straight from the big toe over just a little lateral to the outside of the body, and then you can feel it there. And his is strong. It's regular. Okay, and again, you compare bilaterally. The other one would be, let's do this one so you can see it. The posterior tibialis, which is going to be right inside the ankle here. This one's a little bit difficult to find. You have to move around and palpate just a little bit. And I can feel it there. Okay, then one that we don't often do, but that is added with this, is the Popliteal Pulse. So it's going to be directly behind the knee, about midline of the knee. And you just make sure you don't occlude it, don't press really hard. Go ahead and just relax. Yeah, and that one's kind of faint. That one's kind of hard to feel. So you might have to move around a little bit there. But again, you're checking for circulation. Okay, so then the last thing for this portion we're going to talk about is range of motion. So while he's sitting in this position, we're going to do a couple of things. Normally, when the patient's laying down in bed, there would be a better routine or approach to this. But for this purpose, we're going to go ahead and I'm going to kind of start and go backwards. So for the range of motion, I'm going to start at the feet. I'm going to have you, first of all, I'm going to test some strength. So go ahead and take your foot and press against my hand that way. So pull your foot that way. Okay? Now push against me. So again, we're testing for strength there. You would do that bilaterally, just like you do in the upper extremities as well. Okay? So scoot back just a hair. Okay? To test the ankle range of motion, okay, we would do eversion and inversion, which is going to be away and into the body. Okay? So we would scoot the heel back this way, or the ankle back that way, outwards, away from the body, and then back into the body. Okay? And be looking for trauma, any tenderness, any pain, anything like that, anything that would be causing a lack of range of motion, okay, that we could address there. Okay, so the other thing we do is ask the patient to do a circular motion with your foot. So do like this with your ankle here. Yeah, and that tests all of the directions. So if there was a problem, obviously we would know where that problem existed, because he wouldn't be able to do that, or we'd be having significant pain with that. Okay, so now with the feet, going kind of back to the feet here, we're going to dorsiflex and plantar flex. So straighten your foot out as far as you can this way. There you go. Now back to you. Bringing it in close to your body as you can. Okay, good. All right, and you do that with both feet as well. And we talked about the ankle in and out that way. The knee, if there was damage to the knee, there's a couple of things that we can do. I'm not going to do it on here, but the shelf test, if you like had an ACL tear or something, that actually would allow for the knee to kind of detach a little bit and pull out. And so if it had that motion, you know that there was possibly a tear there. So you could do that. And then also, I'm trying to think, you can go side to side as well. There's something called the valgus and varus test, where it's a stress test where you go from side to side on the knee. So you would take one hand here, the other one here, and you would do this laying down as well, or you could do it up here, and you would pull and push in opposite directions. Okay, do that, and then that way. And then you could see if there was actually any problem with the knee there. Okay, so we have that with the knees. Let's go ahead and lay down, and we'll do our best here to do hip range of motion. Okay, so we have flexion and extension with the hip. So I'm going to have you take one leg all the way up. Okay, now back down. I'm not going to have him do this, but you could have the patient turn over and then extend their leg backwards behind them, which would show extension. Okay, so we have that. And then let's go ahead and I'm going to have you put up your leg here. And this is kind of an internal and an external rotation as well, but we're going to kind of abduct and adduct here. So what we're going to do is take the leg and actually take it to the medial side or to the center of the body, this way. Okay, and then we're going to go the opposite way, which is abducting. Okay, and there's no pain, tenderness. I don't hear any crepitus. I don't feel any crepitus, and I don't hear any grating of the bone. So he's fine there. You would do that with both limbs as well. Okay, and then the other thing we'll do is have you lay on your side.
This way.
Go ahead, just turn that way. Lay on your side that way. And then again, abduct and adduct. So take this one leg and try to lift it to the ceiling. There you go. All right, take it back down. Okay, and then we would actually have them, we had abduction here, which is way, and then adduction back, and see if they could actually come across as well. We kind of did that laying on the back as well. So once again, you do everything symmetrically to the body. You would approach it symmetrically and bilaterally. So we're not going to do that here, but he looks fine. And so if there were any issues, then we would know how to focus our assessment from that point on. Thank you.